Good afternoon. I'm Josh Mailman. I'm the president of NorCal CarciNET community, and I'm here today to speak to you about being an engaged patient. So let's talk about this for a second. You know, the title of my talk is Being an Engaged Patient and trying to understand what it's like to live in this crazy neuroendocrine world. And actually, it was interesting. Preparing for this, I realized I talked a little bit about this in 2017 at the LACNETS conference. So I used a lot of the information from that conference, but I've added a few more things. So a couple of things. First of all, let's put this all together. We're now at the end of the day. We've had a lot of conversations, but first I'm going to talk a little bit about who I am. I was a blind pickup in 2007. I attended my first support group in 2007 as well, my first conference in 2008, had my first gallium-68 scan in 2008, largely because I went to a medical conference, or actually a patient conference in Canada. I've been on many medical society boards, but some of my first, I'm now the first patient to serve on the advisory committee for the use of medical isotopes. That was in 2021. I'm now the first neuroendocrine patient to serve as co-chair of the NCI Patient Advocate Steering Committee. I did write a little bit about this in this article that I published actually on my birthday in 2015 on Living with a Rare Cancer, my Dr. Seuss world. So if you have a chance and want to look at the whole story, feel free to check that out. As you know, there is no class for this. In a blink of an eye, our lives change forever. Everyone comes out of the woodwork telling you how to help, how to cure your disease, what to do. Most of them will send you on a wild goose chase. You'll see the University of Google. I know all too many of us have gone there. But take a deep breath, especially at the end of the day today. You're not alone. There's hundreds of thousands of patients around the world, over 100,000 in the United States, and there's thousands of medical professionals who have made working on nets their passion. So really, we're not alone. And you've already taken one major step today, right? Today was a master class. So while there's no class for cancer, and especially our rare cancer, what you've just done is gone through a master class from surgery to testing to treatment to liver-directed to the latest in imaging and PRT to managing your symptoms to achieving the best outcomes and how our healthcare delivered. That's a lot to swallow, actually. I think that's the challenge, at least for me. In 2007, I didn't have a lot of challenges. There wasn't a lot for me that I could do. We didn't have that list of options that you see there now. When I was first diagnosed, there was watchful waiting, which I prefer to call watchful learning, and also the terms of fighting a war, being in a battle, and those didn't resonate very well with me as well. So I turned the watchful waiting into watchful learning. And I ended up at a clinic across the street. This was the Integrative Oncology Clinic, where I learned about what are your hopes, what brings you joy. And I mentioned this in becoming an engaged patient because being an engaged patient is not only knowing everything about your disease and what the options might be, but also taking care of yourself, being fully engaged in your life. So as I said early on, finding a support group, and this is an old Animal House reference for those of you who need those references to keep you engaged. Support groups are really positive. The sharing of information is fantastic. The supportive environment's great, but we do have some challenges that we'll talk about a little bit as we go through this. Not all the information is always accurate, and it's not all centered around you. And this is really important. You are an N of one. As I said, in 2007, being an engaged patient and knowing what my options are were pretty easy. Once I had progression, there wasn't any other options that I could have. I had PRT, which was still experimental in Europe at the time, or I could do nothing. And so my decision tree was really easy. As you've seen today, the decision tree becomes more complicated. And we've heard from all the speakers, all the different complexities that this is. This is actually the NCCN guidelines, which we'll talk about in a little bit. And if you'll notice, after the first two things that you're talking through, standards of care for somatostatin analog, a lot of these things are or. And this is the University of Iowa's treatment matrix, which I'm sharing courtesy of the late Dr. Odoricio. And this is how they go through their decision matrix. There's a lot of things to consider here. So interestingly enough, earlier this year, I actually wrote or was interviewed for an article on Authority magazine on really how I survived cancer. And my main takeaway point was never stop learning. Really research your disease. This was actually featured in a book, but you can actually get the article for free just by going on that link for Authority magazine and reading a little bit about at least my journey. But what I will do is break it down into 5 steps for you. And the first step is really talk about it. This is the first step in really understanding your disease. Talk to your family. But when you talk to them about your goal, your wishes, and challenges. This is really important. We're all different. We all have different goals that we want to achieve. None of us are alike here. The same goes with talk to your medical team. And actually, what you need to talk to your medical team is the exact same thing. They need to understand your goals, your wishes, and your challenges, because even if we're treating the same disease, even if your medical team is treating someone that looks like you, they don't have your same background, they don't have your same history, they don't want to achieve the same things. They want to achieve different things, and that's all great. Lastly, talk to others on the same journey. This is, when I was first diagnosed, we all sit in a waiting room at our oncologist, and no one talks to each other. And it's really hard to engage, which is why these support communities, whether you're with LACNETS, whether you're in my support community or any of the others around the country, this is why it's so important to engage, so you can listen to someone who's sharing the journey with you. But do remember, we're all different. So what might work for my journey may not work for your journey, because we bring different things to it. Our disease is different, and where we are in our lives are different. Step 2, never stop learning. This is really, really important. Do your research. And what I mean by do your research, we can Google all day long, but we really need to learn about things and understand what's applicable to you. And we'll talk about that in a second. But understand the current guidelines from the NCCN. These are the National Comprehensive Cancer Network. These are really important. They help you to determine what the baseline for how you should be treated is. They're not absolutes, they're a starting point, and it's really important to know the starting point so you can talk to your medical team about what they want to do. Ask your team about second opinions. This is something I did a series called Speaking Up, where we talked about talking to doctors. And one of the things that patients were really worried about was getting a second opinion and the challenges of doing that. Honestly, your medical team is probably okay with it and most likely okay with it, and just ask them. And they'll even give you an idea of who are some people you can actually go to for second opinions. There are no perfect answers, however. So one of the things that Giovanna and I would discuss, and I remember many coffees about, were that, when you go and get second and third and fourth opinions, know what you're going for. Try to understand what you're going to learn from that opinion and how to apply it not only at this moment in your journey, but further along as your journey changes and you need to apply your learning for different situations. There is no perfect answer. We don't have all that data. Attend conferences when you can. This is how you learn about new treatments or new understandings and can actually network with other people when we get back to face, and hopefully that will be sometime soon. Always understand your next set of options. I try to stay one step ahead of things, where I'm understanding what might be the next care that I get. Net Vitals is one of those, when you've done your learning, you'll be able to fill in this tool that honestly was created back in 2018 to help you make sure that you can discuss your journey with your medical team and multiple medical teams as you may go throughout your journey. So the little sidebar here, there's two things. First of all, this is a great course that's taught from Yale Medical called Understanding Medical Research, Your Facebook Friend is Wrong. And that isn't to say that all that you learn on Facebook is incorrect, but a lot of it doesn't actually pertain to you or to pertain to being good research. And so this is actually a free course that teaches you how to effectively and efficiently read medical research papers and how to differentiate good and bad research, and the best way to verify claims that are made in news articles, and to understand when it's important that you actually understand an article and when it's way too early for it to impact your care. Talked a little bit about this in the previous slide. Guidelines set a minimum bar. They're not the absolute. They make sure that wherever you go for care, we know that you're at least getting what the consensus from the experts are that every patient who has a neuroendocrine tumor should see. And as you saw earlier in my presentation, you'll see a very detailed flow chart on your specific disease, whether you've had it resected or not, and what the options are for that particular moment. Second opinions. And I know second opinions can be really hard because if you're in an HMO or your insurance doesn't allow second opinions, this can be difficult. And if you really get into one of those binds, just know that you can also see the NIH for free. This is Dr. Del Rivera, who spoke last year at this conference. They will do second opinions for free wherever you are in this country or wherever you are in this world. The other point I wanted to make is know why you want one. Know why you want a second opinion. What are you trying to understand? Not what other treatments are there, because really you can find that out in the guidelines. There's no secret to all the options that are available. It's understanding why someone wants to give you a specific treatment and trying to understand their logic so you can apply it into your case specifically. So step number 3, it's back to enjoy every sandwich. Really don't dwell on the past. Enjoy where you are, not what could have been, not what might have happened if you did one thing beforehand or did a different treatment option, but don't dwell on the past. Enjoy where you are and every moment that you can experience going forward. This came from my support group. When I went to write this article, we were going through these 5 steps, and I was asking them what their feedback was for the 5 steps on living well with cancer. And one of them was, you're mostly well. It's naturally to focus on your cancer and to dwell on that, but it's important to take care of you and to realize that you're actually mostly well. And we just have to take care of a little bit of this cancer that your oncologist is working on. And lastly, I'll close with give back. Participating in clinical trials. I know Dr. Reedy was talking about what the clinical trials were that are available. Some of them aren't interventional. Some of them are understanding natural histories of this disease or what happens to us with our quality of life. So participate in clinical trials so we can find out more. Volunteer with your support community and medical community. How I got my start in working with all those organizations is I put my name out there. I said I was willing to help, and willing to help ended up being, on one research committee, and then that led to other things. Donate to research on the local and national level. There are projects that need to get funded right where you live, right with the doctors you're working with. And there are also really great things to be funded on a national level where we can find the best research and try to actually work on finding what causes this disease and how we can treat it in better fashions. In conclusion, really it comes back to learning about your disease, learning how to know about your disease, whether it's understanding research or understanding the guidelines. Network with other patients so that you can have a set of people to fall back on and to share some of the issues that are going on, and really network with your family and your medical team to make sure they understand what you need. Give back to your community in any way that you can, whether it's participating in clinical trials, donating money, donating time. This all helps the next set of people who will be diagnosed with this disease. And mostly, Enjoy every sandwich. Thank you for your time, and look forward to the question and answers coming up shortly.